We're not particularly good in Canada in delivering healthcare. If you look at the outcomes, particularly of the continental European countries, who tend to get better healthcare, faster access to general practitioners, much faster access to specialists, and they spend less money than we do. Canada is a small country and a huge globe. We're only 2% of the whole output of the world economy. There's lots of countries out there, so there's lots of opportunity when you're studying any policy field to look what works elsewhere. For example, I think there's a tight consensus in the world that Denmark offers the best care for the elderly, and they do it in a completely novel way. They do not build long-term beds. In fact, there's a law in Denmark they're not allowed to build long-term beds, and that forced them to have an efficient connection between the community and home care. We have a beautiful opportunity in Canada because we can have some experimentation. We can benefit from what's working in one place to apply it somewhere else. You will note that when Ontario lowered the price for generic drugs, it was me too, me too. It spread out the rest of the country pretty quickly. So when we do see advances, we can see an opportunity for other provinces to come in and build upon that, but they can learn from each other as well. We have the benefit of working together where it makes sense, and we have the benefit of standing back and allowing some jurisdictions to run experiments. So there's two unique perspectives that are being developed for the Queen's Healthcare Conference. First is absolutely unique. This is the first time we've ever had it coming from a business perspective and from a business school. A lot of Canadians, they'll think that it's not a business, it's about care, it's a social need, it's about equity need. Well, it is a business. In fact, it is the biggest business in Canada. We spend $200 billion. It is a question of efficiency because we know that government budgets are going to be constrained, not just at the moment where they're trying to return to budget balance, but they're going to be restrained for a very long period of time. They can't afford to increase healthcare spending 6 or 7%. So they face a choice. They can cause a deterioration in the quality of care, or they can get more efficient. I think 99.9% of Canadians would vote, let's get more efficient. I'm not quite sure who will be in the 0.01%, maybe somebody out there, but let's face it, we have to make the system more efficient, and that can rely on business processes. The second unique fashion is putting a great deal of emphasis on the process of reform. Most conferences discuss endlessly the substance of the reform. How do we avoid having so many prescriptions